Thank you, everybody, for coming here, for taking the time out of your day, and for showing interest in what we're doing in behavioral health. This week, I had the amazing opportunity to co-sponsor our first rapid improvement event in behavioral health this week at our East County Adult Mental Health Clinic, where we treat those most severely affected by mental illness, as well as substance use coming very soon. During this week, I worked with a team created by Anna Roth and gratefully unleashed upon the behavioral health system to help us with system improvement and change. The team was led by Erica Jensen and Chris Farnatano, two real pros at this, but equally important, the team was staffed by a broad coalition of people, including staff from many different disciplines within and outside of behavioral health, those with lived experience, family members, and stakeholders from all different corners of the behavioral health system in the county. Further, we had a leadership advisory council that also consisted of leadership from many different aspects of our health division, as well as stakeholders from around the community. This event, our first rapid improvement event, is a follow-up on our June value stream mapping event. And during that event, as many of you know, we took a look at the current state of our system, particularly in the East County Adult Mental Health Clinic. And one of the things that came out of that visit was that the first visit was not a useful visit for those seeking services. It was primarily a screening and needs assessment visit without a lot of actual treatment or services provided. This week, we were able to take a week-long intensive look at that first visit, trying to look at that visit through the eyes of a family member or of a person coming to seek services and seeking help. We tried to make it a high-value visit, and we were encouraged to think big and to think outside of the box. And that was just a huge motivator. It took this weight off all our shoulders and allowed us to just do the right thing through the spirit of generosity and service. And I think you'll find that led to a number of really exciting things. I'm really excited by some of the ideas that were generated, by some of the actual changes that were made this week, and most importantly, by the spirit of doing the right thing that was really fostered and generated during this week. I'm hopeful, I'm enthusiastic, and I'm inspired to make these changes an ongoing part of what we do in behavioral health.
Good afternoon. My name is Christy Sutton. I am a Sheriff's Ranger in the Health Security Services Unit, and I'm over at the Pittsburgh Health Center. In June of this year, I was honored to be a part of the Value Stream Mapping event. Now, I'm sure you're all wondering what all these Post-its are on the slide you're seeing. Now, you're in luck because I'm going to tell you what they are. Each Post-it represents a step in our current behavioral healthcare system. The left are all the different access points people can gain access to services. Now, we mapped out each current step, including wait time, from beginning to end. Now, to figure that out, we had teams traveling all over the county to observe and interview staff as well as patients. Locations like the Homeless Mobile Care Unit, the Access Line Call Center, and Psychiatric Emergency Services were some of the locations that we visited. Now, we learned of long wait times to receive services, also archaic and outdated redundant systems and steps in place that hinder patients as well as staff. Now, after a week of navigating through this long, convoluted system, we dreamed of a fresh, patient-oriented experience, which led us to today.
My name is Rohan, and I'm a person. I'm also a patient here who's received therapy for anxiety. I'm also a caregiver for my hero, my big sister, who continues to struggle with severe mental illness, who's had a lot of poor first visit experiences in several counties in this country. I'm also a primary care physician in West County, based in San Pablo, and manage the Department of Family and Adult Medicine as its chair. I'm one of your new county health officers, and this week I was an improvement coach leading a team. The problem is that we divide people up based on their age, based on where they live, and based on their body part. If you're 17 in our children's mental health system, you'll get different care than when you come back from college and you're 23 in crisis in the adult mental health system. If you live in West County, there's different types of value added and different types of waste that I learned this week than in East County. And if you enter physical health and mental health, you're going to get a different experience. All that variability needs to be removed, and we'll cross-pollinate and learn the best of all worlds to create one care for our clients and families. But when somebody calls the access line in crisis, it can take a week just to get an intake appointment to see if you have medical necessity. After that, you're left waiting weeks to months to actually see a doctor and get meds if you need them. You can see the variation on the screen between East and West. And if you know that therapy is an option and you feel trusted enough to ask for it, it can be 6 weeks to even get that. All that leads to needless suffering and ultimately premature death. The greatest health inequity issue we have is that people with severe mental illness die on average 20 years earlier, greater than any other chronic disease or racial disparity in our country. It's National Suicide Prevention Month, and I'm sad to report that still 80 to 100 people take their lives early in our county that could be prevented, like my cousin who completed suicide in India. This is why we're here, and all of this gets absorbed into the staff, the waste, the needless suffering. We feel it in our bodies too, and it affects our joy and work. So if we find waste, we're going to remove it. If we have systems that don't work in paper forms, we're going to burn them and get rid of them, and we're going to rise from those ashes like the phoenix and spread a fire of an improvement and redesign in behavioral health.
I'm Marcia McGinnis, and I'm a family member, and I have a son, adult son, in the Contra Costa behavioral health system. And I'm going to read our vision first and then make a few comments. So our vision is empowering us all to reach our full potential through co-designing accessible, timely, respectful, safe services in the spirit of wellness, hope, resiliency, and recovery. So I've never done this before. It was quite an interesting experience. I wanted to share that with you. I, coming from community and not a county staff person, I think lend itself to the group to have a different perspective and a voice for the families. So the combination of people that were involved were professionals, people with lived experience, and family members. So with that blend, I think the outcomes are far greater because there are bigger voices from different directions. So thank you.
Hi, I'm Jessica Johnson. I'm a mental health clinician and team lead at East County Adult Mental Health. And I had the great pleasure of being involved in the value stream mapping as well as being involved in this week, the Rapid Improvement event. And what I'm going to talk about today is the future state map that we created at that value stream mapping. During the value stream mapping, we created what we want to see as our future state. One of those things was we wanted to have a wellness center instead of having them be called mental health clinics. We also wanted to have a streamlined approach to have more services offered to the client at the first visit. And we want to have the client meet with their care team. And we wanted to create what's called a care team, where it's the psychiatrist, the therapist, and the community support worker all in the same team, and have the client meet that person at the first visit so that we can decrease the client's wait time and have no waste. Thank you.
Hi, my name is Blanca Sanchez. I'm a therapist at East County Adult Mental Health. So we've seen what our aim was this week to co-design accessible, timely, respectful, safe services in the spirit of wellness, hope, resiliency, and recovery. How that was informed, the primary driver was timely delivery of counseling, case management, psychiatry, and other needed services for the client. Specifically, we focused on wait time to see the psychiatrist and therapist, wait time to receive additional services, our environment of care at the clinic, and our efficiency of the visit flow. So we identified some actions to test. We tested providing psychiatric and counseling services at the first visit. We tested providing and connecting a patient to additional services at the first visit, providing a welcoming, easy to navigate experience at our first visit, and streamlining documentation and workflow. So they're going to tell you how that worked.
Hello, everyone. My name is Darren Webb. I'm a substance use counselor at the Access Line. And this week, as we started our work, there was some key principles that we used to guide us in our work and all of what we were going to be doing on this week. Some of those key principles that we used to help us to navigate through what we were doing and also through the activities that we were doing were such principles such as having big eyes, big ears, and a little mouth. And so our focus was to see what is actually going on and not to really speak from our own thoughts and ideas, first. Also, one of the things that we were told as well was to dream big. And that was a challenge for many of us on this week, but we really stayed in that mindset to dream big, meaning to think outside the box, not look at what is currently going on, not to think about rules, regulations, why certain things can't be done, but focus and look at what we could actually get done for the people that we serve. Also, we looked at going from a complex system to a simple system. Also, we looked at redesigning and co-designing, and also to trust the process. And along with trusting the process, that included that we also would show respect. Respect for one another, respect for our communities, respect for our families that we serve, and also the individuals that we serve. We also had a quote that helped us to really think big. And that quote was from Pat Godley, who is the Chief Financial Officer for the Contra Costa County Health Services. And he said, figure out what works for the patient, and then we'll figure out how to pay for it. That is dreaming big.
Hello, I'm Chris Farnatano. I'm your county health officer. I also was one of the co-leads of this workshop this week along with Erica Jensen. I also happen to be a family doctor who works at the Pittsburgh Health Center, and I have many patients who have serious mental illness, and many of them are getting care at the mental health clinic that we focused on redesigning this week. The key tool that the team used to help improve the system: plan, do, study, act. With this model, the team designed a new way of delivering care to the patient, a new way of doing that first visit with a new client. They planned the visit. They actually tested it out with a real live patient who had real life challenges, real life obstacles, real life needs. They then studied how it went. They talked to the patient. They talked to the family member who was with the patient, got their feedback about how the experience was, talked to the staff. And then they acted. They adjusted the model based on that feedback, and then they did it again with another patient, and then with another patient, and then with another patient. Each time they were adjusting the model based on the feedback they got from how that worked. We had 2 testing teams. They each ran 4 or 5 cycles with 4 or 5 different patients, adjusting and tweaking their model to find out what worked for the patient.
Hello, my name is Peter Wong. I'm the substance abuse counselor out of Central County Adult Mental Health. I'm here to present the off-site visits as part of the strategy to experience what it would feel like as first contact by a client and how it would fit in our model. We have different teams that actually ventured out to different sites to gather information on what their experience was like at their first visit. And with the information that was gathered, the general overview from the feedback, that was they were greeted warmly. It was a friendly environment. It was very welcoming. And one of the main focus that I thought about was that they said it was client-centered. Personally, I learned that the clients were valued, treated with respect, and empowered. Thank you.
Hi, I'm Kirsten Hare. I'm the family support worker working out of the Central County Adult Mental Health Clinic, and I'm also a family member. So what we tested this week came down to a person-centered, team-based care approach. So we did that through various models. We tested the co-visit, which included a doctor and a therapist. We tested home visits, including the whole care team. And we tested televisits, both with telepsychiatry and teletherapy. We introduced a menu of services so that clients and family members would be aware of what the clinic offers on day one, including services like alcohol and other drugs counseling and family support. We experimented with reducing and eliminating unnecessary forms, and you'll learn a lot more about the enhancements that were made to the electronic health record, as well as a welcoming environment provided in the physical space of the clinic.
Hi, I'm Susan Waters, and I am the family support worker at the East County Adult Mental Health Clinic and also a family member. Historically, the East County Mental Health Clinic has had a no-show rate for first-time appointments of greater than 40%. In January, we implemented a program to help to reduce those numbers of no-shows. Each person coming to the clinic for the first time receives a call where we ask questions to inquire about any concerns or questions they may have about their first-time appointment. We also inquire about their need for transportation. When transportation is a barrier, they can be referred to the Office of Consumer Empowerment to work with one of the navigational specialists, or when their Medi-Cal is linked to CCHP, we're able to provide the CCHP transportation voucher phone number. Those efforts have brought our no-show rate down to 25%. However, our goal is 15%. So this week provided us with a wonderful opportunity to get together and to brainstorm how do we improve those numbers even more. So what we tried out was that a member of the individual's care team contacted that person the day before, introduced themselves, again, inquired about how they were getting here, any questions they may have. We identified somebody who was at risk of a no-show, and so the entire care team went to the home, and we managed to get that first appointment done. So I'm proud to inform you that 9 out of 10 patients made it to their appointments this week, and our no-show rate was 10%.
Hi, my name is Crystal Whitehead. I'm one of the community support workers at East County Adult Mental Health. I am also a person with lived experience, and I'm also a parent of a child who receives services in the behavioral health system in this county. I was on the team of the first visit when we did the co-visit with the therapist and or the doctor during this first visit. During this first visit, we allowed the person who came in to receive services to choose who they wanted to see. We gave them the option, would you like to see the therapist today, the psychiatrist, or would you like to see both? And we allowed them to choose who their provider was. And during this first visit, most people come in and they just want medication. However, we gave them an option of their choices, like these are the services we offer. And they were, knowing that we had these other services, they were able to pick other services that they wanted, and we were able to provide them that same day. And in doing that, the person, when they left after that first initial visit, they felt like they were heard and they really got their needs met.
Hi, my name is Valentina Loreto Ashley. I am the lead registered nurse at East County Adult Mental Health. So there was a patient scheduled for this week during the Rapid Improvement event, and he could not come to the clinic. So as Susan said earlier, we thought and we decided to do a home visit. And that's the home team. I was honored as a former case manager and a home health nurse to be welcomed by this patient and his family that has never met us before. And we presented all together. There was the psychiatrist, the therapist, the community health worker, registered nurse, and also the quality manager for patient customer service interview. So it was an amazing visit. The patient started pouring in. He tried contact with services and help before, but this was the first time he was able to talk to us, and he talked. He got a full evaluation. He got prescriptions. He got a follow-up appointment with the psychiatrist, with the therapist, and also with his medical provider for his medical needs.
Now, we've all seen the doctors on TV, and while I'm regularly one of those guys, today I'm coming to you live in Martinez and by live stream worldwide. My name is Jonathan Terry, and I am so proud to be one of the psychiatrists on the East County team, where I see patients 5 days each week. The caveat to that is that I see them all remotely by telemedicine. This week, we wanted to test to see if we could seamlessly integrate telemedicine into our rapid improvement models. And this team that you see today, we tested it not just once, but 3 separate times, running different trials, seeing if we could incorporate the team, make it feel like an in-person visit, have the same value that we've been striving for this week. And I'm pleased to say we did it. We also discussed additional ways that we might expand our telemedicine model. Can we bring it into the home visit? Can we expand it into other services to bring the visit to the patient instead of requiring the patient to come to the visit?
Good afternoon. My name is Noelia Gutierrez. I am an administrative services assistant with Contra Costa Health Services, and healthcare needs to be more customer service focused. So we interviewed online clients and families after their visits this week, and this real-time customer feedback enabled us to make quick improvements. For example, we were able to find a headset that would fit underneath the glass so that the language line and the registration clerk would be able to assist the client in the language they're most comfortable with. Thank you.
Hello, my name is Julie Horvath, and I'm a 2018 Spirit graduate. Also, I'm volunteering at East County right now. I'd like to share with you a few client quotes that we received while doing our study. First one was, "This clinic nailed it on the head." Another one I thought was very beneficial was, "I got a lot of stuff done today." And the third one, which is my favorite one, the client asked about their doctor. She said, "My doctor is hella chill." Thank you.
Hello, my name is Afshin Fanayan. I am one of the mental health clinical specialists working with Community Connect. And I had the pleasure working with a team to create a menu as part of the process for rapid improvement. And then the menu was created for educating the client and the family about the available services, as well as using it as a visual reminder for the clinicians and a communication tool.
Hello, my name is Rachel Taylor, and I'm a clinical case manager at East County Adult Mental Health. We found that our menu of services works because we were able to give our clients a visual list of options to select from to meet their needs. It was easy to understand, and it helped providers actually offer all available services during the first visit. The menu of services also helps us as providers in our goal of partnering with our clients. which increases client engagement in their treatment plan.
Hi, my name is Xiaoli Ji. I'm from NAMI Contra Costa. Also, I'm a family member. And there are always challenges for the manual of service, such as difficulty finding plan language. And manual is a living document that needs frequently updates. And I want to say a few words. It's not on the slides. I'm a family member, and I'm so pleased to volunteer join this program this whole week. Before I see all the doctors is inside of the building, they have a lot of knowledge and specialist professional. We don't see them until we have to. But this whole week, I see them in person. They have very warm heart, a lot of care. It's amazing, yes. And I also see what they try for the patients. For the first visit, the patient got enough service, got a doctor prescription, got a therapist, got a follow-up. All of happened in one visit, one day. So that's so amazing. When I observe that, in my mind, I wish that happened to me years ago when I took my daughter for the first visit. And I feel so happy for right now. Dream come true. And it's great. They're saving life. And tomorrow, Saturday, I volunteer to teach NAMI family-to-family class in Mandarin. And I will let everybody know that's a dream come true. There's a hope. Thank you. 谢谢.
My name is Benjamin Huffman. I'm a therapist at the Older Adult Mental Health Clinic, and I'd like to talk about what our next steps are with this menu of service tool we've been using. As you can hear, we had a lot of really good results using it. Worked like a checklist for us, was helpful for clients to get to choose what they got to work on. But we only had a week, and there's a lot more we could do. We'd like to see the menu translated into many languages so that it can be easily read by anyone who stops by the clinic. We'd also like to include some iconography so people with low reading comprehension have a simpler time. We have tried to make it as plain as possible, but there's still some lingo on it. And lastly, we need to continue to work to be comprehensive in the way we identify treatment options. Those will constantly change over time as new programs start and old programs close, so it's just something that's going to need to be constantly updated. Thank you.
Hey everyone, I'm Karen Schlein. I'm the Assistant Director of Population Health at the Contra Costa Health Plan. So before these improvements, what would happen when a patient walked into the clinic, they'd be faced with some plexiglass, and through that, some big stack of forms would be handed to them. We discovered that in those forms, there were 86 fields that they had to fill out, and that took anywhere, we observed, from 15 to 35 minutes. They were asked things like for their driver's license number, for their mother's social security number, and those forms used words like guarantor. We found out then, by going into our two databases that we have, Epic and ShareCare, that about 75% of the information that they were asked to write down, we already had in those databases. On the other side, for our staff, we observed that the clerks are spending 10, 15 minutes to enter each of these packets, looking at the paper, looking at two databases just to validate that the information is the same in both places. And not surprisingly, these clerks have a 6-week backlog of packets to enter. So my colleague Chris, who's coming up, is going to tell you about how we can use some improvements with our electronic medical record and other technology solutions to avoid this waste. Thank you.
Hi, I'm Chris Chandry. I'm the behavioral health analyst for Contra Costa County. And I just want to say I was honored to be a part of this event. It's rare that IT gets a chance to actually see what's going on. And I've never worked with more passionate people in my life. And there is no way that we can't, in IT, do everything we can to help you guys see the patients. The time that you spend having to work in the EMR is time not spent with the patient. So the charge this week was to give you guys more time with the patient, and I think we did it. We did a couple things immediately that those clinicians and physicians in the room, when you get back to your office, try this out. First of all, we have all the access line information now available with one button on your index. You just pick it up, everything, the phone call, the note, right there for you. So you don't have to ask the questions again. Before you had to ask why they came in, well, the access center asked those questions, or access line. So now you'll get that immediately. The second point, pre-charting. You guys can now pre-chart starting today. So go in, open up the chart, the partnership plan, and get 70% of it done before you actually meet with the patient and get it done. So those are live now. Those were, we had the right people in the room to get it done immediately. We have three big ones that we're going to work on as well. One is the referral, which kind of goes to some binder, trapper, keeper that no one looks at. So we are going to try to make that electronic. That work is currently happening. As Karen mentioned, we're going to make that registration packet be more of a form on demand. You hit it, and then so you have those fields filled out. Then it's real easy for the patient to go to the fields that are not filled out and just fill that up. And then last is our future appointments. We're still using the triplicate form, amazingly, and that can easily be accomplished in Epic, and we plan to implement that real soon here. So, thank you.
Hi, my name is Adam Down. I'm the training coordinator and ethnic service manager for the Behavioral Health Division. I'm also a 2018 Change Agent Fellow. And this week I had the opportunity to be the team lead for the group working on welcome environments. As we all know, the customer experience begins before any personal interactions. It's your physical space around you as you're walking in. My team started out on Monday afternoon at the bus stop and walked in and really tried to view the clinic through the peer's eyes. We found that there were many ways we can improve that experience. There was an absence of knowledge from the ambulatory care staff about their behavioral health colleagues that they've been working next to for sometimes years and years and years. They had no idea of the services that were provided down there. We were taking some actions around that. We found a clean but overall cluttered lobby that could be, addressed to make, feel more welcoming. And finally, there was a sort of a lack of signage to lead to the mental health clinic. And, we've been joking about it, but if you think redesigning the first visit is hard, try hanging a sign in the lobby. Anyway, these observations informed our interventions and tests throughout the week.
Hi, my name is Gabriela Bonilla, and I'm a student intern at Contra Costa Regional Medical Center, working in the Safety and Performance Improvement Department, and I was honored to be part of this team this week. So the question was, how do we create this welcoming environment for our patients? So some of the things that we worked on was we actually put signs up at the entrances of the clinic so patients knew where to find us, and they had provider names so they could just look and easily find us on the second floor. We also reorganized boards so that we had relevant and up-to-date information that patients could actually use. We also had a welcoming table where we greeted our patients with a smile, gave them some water, and asked them if they would like to color while they waited. We also had an open house with just to invite the other departments that didn't really know about what we did to have a meet and greet with our staff to learn more about what we did. Finally, we also had a hygiene kit. We acquired some hygiene kits, and we were able to provide a shower for one of our patients that was experiencing homelessness. Thank you.
Hello, my name is Bernie Sanabria. I am the program supervisor at East County Adult Mental Health. And I wanted to tell you about our open house that we had. We were able to crack and break a little bit into the silos at the Pittsburgh Health Clinic. We were building connections with our clinic neighbors within the Pittsburgh Health Clinic. For a start, we had 18 guests come into our clinic. We greeted them and we did a tour of our entire back part of our clinic. We had doctors, we had part of the dental team come to our clinic, as well as social workers and staff from the physical therapy office on the 5th floor. One of the staff mentioned that this is so nice. I've been here for 7 years and had no idea.
Hi, my name is Stephanie Batchelor. I'm a community support worker at Miller Wellness Center, Behavioral Health. By finding waste and adding value, getting rid of the waste and adding value, on the 5th floor, they had a staff bathroom where they kept all their exercise balls in the shower and had a storage facility there. So by cleaning that out, having housekeeping clean it up, we were able to have a patient come in that was homeless, provided them little stockings thanks to the physical therapy, which was very welcoming, and he was able to take a shower, and he was very clean about it, cleaned up after himself, and knowing what it's like to be homeless, a shower is very welcoming. And his last words were, "God bless you."
Hi everyone, my name is Jenny. I work as a clerical lead at West County Adult Behavioral Health. And as my colleague said, we tested out a couple ideas that we had. Unfortunately, we didn't have enough time to test all the other ideas that we had, but hopefully we'll be able to keep some of these still in play at East County, such as having a greeter at the lobby. Someone either could be a volunteer or a staff member or even a community support worker, just to be there either to hand out water or hand out a coloring page to help the patient relax, or to just answer any questions that they might have. The other thing that we were working on is trying to get a video to be playing in the lobby, either something uplifting, a calming, or even informational. One of the suggestions that one of the patients actually said was if we can have plants, something tangible, something living, something that won't feel the lobby so sterile. And the other thing that we're hoping to continue is to keep having those hygiene kits. That way we can keep providing showers for those who need it.
Hi, everybody. My name's Tommy. I'm the program manager for behavioral health at Miller Wellness Center. And I used to be an intake clinician, and I can't tell you how exciting this was. We took a process that took like 60 to 90 minutes and did it in 7 minutes. And we increased patient satisfaction, and they felt heard and understood because we took the questions and we pushed them to the side and we engaged and developed an interpersonal relationship with them, which made all the difference. And they got meds that day, which as an intake clinician, handing someone an appointment for 60 days away with a doctor is heartbreaking. It harms us too. So some of the quotes that we have, a patient saying, on second thought, I would like help. That interpersonal connection we made instead of going through this list of questions is so powerful because when someone's ambivalent about treatment, we have that connection with them to help guide them as a partner. Before a patient visit, I've said this about my doctor, I hope this next doctor listens to me as well as I listen to her. After that visit, the patient said, I speak up now. I learned I had to be my own advocate. So having that menu, instead of someone telling you what you're going to get, but being able to select when you're like educated and understanding about what the services are is super empowering. This was amazing. A patient left and said, you always make me smile. And the clinical staff responded, actually, I think it's the other way around.
Hi, good afternoon. My name is Priscilla Aguirre, and I'm the quality manager for behavioral health. And I'm sure after hearing my colleagues talk about this week's activities, you're probably wondering, so how will we know whether or not we've made improvement? So what we wanted to do is take a look at our current state as well as thinking about the activities we did in future state. And we wanted to think about, what are the things, the tangible things that we would be able to measure specifically, and hopefully make some projections on what we hope we will see and be able to do based on the activities that we looked at. Some of the measures that you see here are, for example, we were interested in taking a look at the percent and number of first visits with a therapist and a doctor in the first visit. And then also the first visit, take a look at the number and percent who actually had a peer. We wanted to measure how many of our patients actually received a warm reminder call before their visit to remind them about their appointment. As you heard from one of my colleagues, Karen, she talked about how we really reviewed reducing and eliminating some of those forms, those registration forms. And so we thought, let's take a look at the percent of data at registration that's already in our electronic health records system. We also developed several measures around the welcoming environment, timeliness to the first appointment, as well as no-shows. And the idea is that we want to be able to track this information over time. We want to take a look to see what happened after 30 days of these activities, what happens after 60 days, 90 days, and beyond, in hopes that we start to measure our success. Thank you.
I'd like to start by saying this past week has been incredibly inspiring for me. We worked with a great team, and I just left, like right now, I'm feeling so very hopeful about the changes we can make to improve the services to patients and families by removing barriers and providing timely access to services in a very warm and person-centered way. So as you can tell, we've done a lot. We have a lot of accomplishments. So I'm just going to sum up what we've done over the past week. So basically, we developed and designed several models. We went out and tested those models, and we gathered a lot of data. And then finally, we came up with a few different models that we really think works for the patient. Patient-centered, timely access.
Now, PowerPoints are a lot of fun. But we also know, working in mental health, that sometimes it can get a bit dramatic. So I would ask you to please put your hands together to welcome our Rapid Improvement Team Drama Team. Now, what we are going to demonstrate to you today is a tale of two cities, the best of visits and the worst of visits. We're here to show you, I exaggerate, but we're here to show you in this largely improvisational and very poorly rehearsed skit. We are going to be having Valentina, Julie, and Chad representing staff members in Pittsburgh at the East County Mental Health Clinic, and we are going to welcome Darren as our model patient coming through the system. Now, I mentioned Darren as a model patient because he actually called the CCHP case manager, and he arranged his ride 7 to 10 days ahead of the visit, as he has to do to come on in. As Darren comes to the visit, he's greeted at the plexiglass window, where he is handed a small ream of the rainforest that he is asked to now go to the waiting room, make new friends, and fill that out for about 30 minutes. After about 30 minutes of filling out those forms, Darren is called back to meet with the intake clinician, where he'll spend about 60 minutes. He meets with Julie, our intake clinician, who is excellent, and hands Darren one of those triplicate slips that we still have from 1982 with a visit in 3 months to come back to the clinic. Darren is also handed a bus pass, and he is wished well and the best of luck as he has to navigate the bus system to now go to see our friends at the Miller Wellness Center for his initial psychiatric visit. About 3 months later, Darren is called for his return to see his psychiatrist. In this case, he's going to see Chad as the psychiatrist. Another excellent visit, of course. And during that visit, Darren makes his needs known, and Dr. Chad is able to identify that Darren could actually really benefit from some psychotherapy, maybe some case management. So have we got the perfect thing for him? We are going to fill out a paper referral form, and we are going to put it into the binders of doom. Now about 4 months elapses, and Darren is figuring out how to get by with, of course, some good medication management from Dr. Chad. We reach his form in the referral binder, and it's finally our chance to call him. So we go ahead, we call up Darren, ring, ring. All right. Thank you, Darren. For our next example, in a much more family-focused way, we would like to invite Shelley and Priscilla to come on up as a patient and family member. Now, they are coming up. They do see this plexiglass thing in the distance, but before they even reach that, they are intercepted by community support worker Julie, who takes them back. Instead of signing the ream of paper and all these different forms, instead, she's given 2 simple consent forms that are being presented as permission slips for us to be able to care for their needs. While in the visit, she meets, the family is able to meet with Julie, serving as our therapist, and Dr. Chad again, as they are presented with a menu of services. The family makes known all the different things that they might be able to access in the county, things they didn't even know existed. In the second model, the wait time for this whole process was 0 minutes. We don't even remember if there was a waiting room. We compare that to the slides that we've seen before, with 139 days to see a psychiatrist, 6 weeks to see a therapist, and so many of our calls going unanswered. Let's hear it again for our drama troupe.
So this is a long week. This team was here all day long, Monday, Tuesday, Wednesday, Thursday, working hard, putting their hearts into it. And at the end of the day yesterday, we had a chance for the team to get together and sit back and reflect on the week. And I heard a lot of themes come through. I heard amazement. The team expressed their amazement about how much they were able to get accomplished this week. I heard talk about empowerment. Not only the staff, the team members felt like they had been empowered this week to really make real change, real significant change in the way we do things. But they felt like these changes were really empowering to our patients, our clients that we're serving. There was a lot of expression of gratitude. The team felt gratitude that they had been invited in and allowed to participate in this process and be part of making the system better. But also they heard a lot of gratitude among the patients that we interacted with, the patients that were willing to participate in these new test models, and that they were able to get the services that they were looking for, and they were able to get them right away. So we felt a lot of gratitude from the patients. There's a lot of talk about recovery, and it was stated that all of us need recovery. Our clients need recovery, our family members need recovery, and our staff need recovery. And then there was a lot of mention about these changes, how these changes can be life-saving for our patients. We know that patients with people with serious mental illnesses have a life expectancy that's 20 to 30 years shorter. And so by providing them with the care they need when they need it can change all that, can really save lives. So these changes will save lives.
I'm Erica Jensen. I have suffered from both depression and anxiety, and I have family members who are also in recovery and who are still suffering. I am also proud to be the assistant to the Health Services Director, Anna Roth, here at Contra Costa Health Services, of thanking everyone. So certainly you've heard from all the team members, but we wanted to also acknowledge the rest of the people in our community who helped make this happen. So certainly the East County Adult Mental Health staff. We were in their clinic, we were in their conference rooms, we were messing with their schedule, we were taking their binders, we were putting things up on the TV, we were running in and out, we were changing their lobby, we were having an open house. So they were amazing and welcoming, and that it was really lovely to. The Pittsburgh Health Clinic staff, the whole Pittsburgh Health Center, which also consists of people who work in ambulatory or primary care, as well as people who work in public health, welcomed us. Some people came to the report out this morning that we had there. They also came to the open house. They were also so happy to learn about the services that we provide in the mental health clinic. We had some key subject matter experts. So Bless is not here. She was our utilization review person who came, and she, at the beginning of the week, people were talking a lot about regulations and what can we do. And Bless came, and I said, if anyone asks you any questions about regulations, you are to answer with, what does the patient need? And she willingly and happily fulfilled that role. We also had some amazing data people who are also not here, and then there are a couple other members of our team who couldn't make it here, but you'll see in the pictures. We also were able to get out of the clinic to go out to many different site visits. You saw some of those, John Muir, Recovery Innovations, sorry, I'm totally blanking now. Federal Glover's office, the Putnam Clubhouse, so many other, Miller Wellness, so many other places that people named on our team as places that they felt welcomed to, and we wanted to go see what their care systems were like and what the feeling was there. I also wanted to call out our sponsors, Anna Roth and Dr. Matthew White, for really sponsoring this work and leading us. And then also behind the scenes every day, Monday through Wednesday at 4:30, after our team left, we had a leadership advisory support group, and that was people who either came in person or who called in to hear what the team had done during the week, to offer perspectives or different ideas that then we took back to the team the next morning. So many of them are here today. If you would just stand up if you're here, and we could give you a... And finally, I wanted to thank our clients and family members and community members. As you heard, we could not have done this without them, without people like Shelley and Julie and Tiffany and Marcia on our team, changing the conversations that we had. And we also couldn't have done it without the people who come to our clinic who are seeking services. So I was mostly in the conference room sort of holding the space, but I got to go up into the waiting room and check out what was happening, and there was a young woman there sitting next to her boyfriend who was clearly in distress. And I sat next to her, and I just said, hey, how's it going? And she didn't look at me and barely answered me, and I said, oh, is this your first visit? And she said, yes. And then she said, I thought I was supposed to get some paperwork, and they haven't given it to me yet. And I said, you know what, we're testing something different today. You don't have to do any paperwork. And you could just see kind of the weight fall off of her. And I hung around in the lobby there until she got called in, and Crystal, our amazing community support worker and peer, called her in and welcomed her, and she asked as she entered, she said, her boyfriend was still sitting in the chair, she said, can he come with me? And I could hear Crystal from across the lobby, of course, come on in, everyone's welcome. And that was just another weight lifted off of her. I got to come in at the end of the visit. It was a televisit, so I got to come into the conference room, and I could see her and her boyfriend a little bit on the screen, and I ran up to the team, and I said, how did it go? And they were like, we gave her what she needed today. And I was just so proud and happy and grateful that I could be a part of that process. And then I left and I went to the elevator and I actually met them at the elevator and I said, hey, how did it go? And she just looked at me and she smiled. And her boyfriend said, this was a lot more comfortable than we thought it was going to be. And that's really why we're doing this work. So I thank you so much, and I wanted to thank the team. So please, if the team could stand up. I just have one last thing to say. I think I learned a lot from the team this week. I was a team leader, but I always learn a lot from the teams. And I think one of the things that we really talked about this week was how do we sustain this? And the conversation went to, are there incentives for clients? Are there incentives for providers? And really what I felt like the deep question that people were asking was about how do we keep our hearts and our minds open after this week? How do we sustain this for ourselves and for our clients? And this image it's a visual puzzle. So there's a white vase in the middle, and there are two faces in black looking at each other. And what I felt like we really did as a team this week was to really try to remember that there are both perspectives. There's the perspective of the clients, of the community, of people, and there's also the perspective of the system. And we need to merge those in order for us to move forward. And I think the other thing that I learned is that we all need connection. And we also all need practical things. So we all need a human connection and then maybe a shower or a prescription for medication or some food or some water or some coloring. And so I just, I wanted to thank everyone for the privilege of being the team leader this week. And just, I think I'm just really grateful. Thank you. And now I wanted to invite Anna Roth, our Health Services Director, to say a few words. And I think some other people maybe want to talk.
I have my tissue. I just want to start by saying I got everybody's text message. I was crying too. So I wanted to start with a quote. Some of you have heard it, but I want to say it again. In reflecting this particular report out, it's from one of my favorite authors, Brene Brown, and she says that in the absence of love, connection, and belonging, there is always suffering. And that goes for all of us. I'm overcome by the work that you've done this week. It's incredible work. It takes a lot of courage, and Brene Brown writes about this too. That quote's found in her book, Daring Greatly, and it really talks about one of the most frightening things we can do is be vulnerable. And it takes a lot to do this work, to let people come into your workspace and essentially take it apart. Right? Look at it from every angle. It takes a lot of courage. So I want to congratulate you and tell you how inspired I am by your courage in doing that. We heard a lot of quotes today. We heard about warm hearts. We heard about dreaming big. We heard about bringing the visit to the patient. And as I started to think about this, I started to think about, so I'm a nurse by background, and I started to think about these these two quotes really, kind of two spins on a particular quote. One of that is from Louis Pasteur. He's really the pioneer of the germ theory. I'm sorry to go there, but I'm a healthcare practitioner by background. And he says that chance favors the prepared mind. So he's talking about testing and testing and testing again and doing research, and you did that. Right? There's sort of a modern spin on this. He's from a modern thinker called Stephen Johnson. Some of you who are coming to COCO 2020 will meet his mother, Beverly Johnson. But Stephen Johnson has a TED Talk, and it's about where ideas, good ideas come from. And what he says is there's no such thing as these eureka moments, that it comes from building on connections, from a fluid network of ideas coming together. And he says that chance favors the connected mind. And as I was listening to you all today, I was thinking about that I have a slightly different take on it. And for me, as I watched sort of the work come together today, I really thought that for me, it looked to me like chance really favors the connected heart. And you guys really did the work of the heart this week. So I just want to thank you for all your work. I know this is the beginning, and I'm so excited to watch this journey unfold. I'm so excited for the people we serve and really the people who serve them. It's such an amazing and worthwhile effort. So thank you all. And I know that Supervisor Burgess is here right now, and she's waiting to come up and talk. So I want to invite her up because she's been truly a champion of the work and really has been with us by our side through this whole process. So thank you so much for being here today.
Anna is such an eloquent speaker, it's hard to come behind her. So I spent a lot of time listening and not really thinking about what I was going to say. I'm also a human, and I'm a county supervisor, which is such a privilege. But I think what led me to this position was life experiences that have been unique and interesting, that gives me a lot of empathy and a lot of compassion and a lot of interest in making things better. And the first report out, I talked about how vulnerable it must feel to put a light on things and examine how they're not working necessarily the way you want them to. And then to do that and then have to go back to work and wondering what that means. Are we going to do anything? So I hope you see this as a result that we are hearing and we are doing, and we do intend to continue to put a light on things and to empower you. And I see all of this excitement and this energy, and I can't help but wonder how it makes you look forward to going to work and how that impacts the very people that you're helping. Because if you're not worried about, whether you're doing things right or if things aren't going well, if you're actually just getting to be creative and think about customer service, what a difference that makes. So happy Friday, and thank you for all you do. Thank you.
Thank you all for being here. The work that we did is up on the walls. Particularly, I would point you to the quotes on the back wall, as well as the reflections of the team, but you can look at all the work that we did. And our next Rapid Improvement event will be the last week of November, the week after Thanksgiving. And we're going to focus on the many places where clients and patients may get screened and how we can streamline that. So thank you all for coming.